Good evening, everyone. Are we live? There we are. Good evening, everyone. Welcome to another episode of the Alumni Speak show. My name is Sam Henry, co-founder of GT. I also serve as the vice president and programs chair of this chapter. And this chapter is the Morgan State University Entrepreneurship Alumni Chapter. A little bit about our chapter. We are an official chartered chapter of the MSU National Alumni Association. We were just chartered about this time last year, so we're about a year old now. And our mission is to maintain a network of MSU alumni entrepreneurs for business opportunities to serve as an entrepreneur development resource for students, the overall university, and the surrounding community. So Alumni Speak is one of our main programs, and the goal of it, and we do this every month, so it's a monthly show, and our goal is to feature Morgan alum who have businesses in specific industries. So we pick a different industry every month. This month we're going to deep dive into the health and nutrition industry, and we've got some Morgan alum experts on to talk about that, and I'll introduce them in a second. But that's our goal, is to bring on Morgan alum entrepreneurs, and I'll be asking them various questions about their business, how they got started, challenges they face, trends they're seeing, and things that they're excited about in their industries. And this is a live recording. It's a live discussion. If you're watching on YouTube, we also have a chat window. So if you'd like to ask questions of our guest tonight, you can feel free to throw a question in that chat window, and hopefully I'll remember to take a look at it and address your questions to the guest. So I'll also be well, I mentioned that the open the Q&A. You can ask questions through our live chat. So health and wellness. We've done a couple of different industries over the past few months that we've done this, and this industry is probably one of the fastest growing. Did a little bit of research. Our guest can definitely tell you much more than I can, but from what I saw, this globally, this industry is about a $3.4 trillion industry. So lots of opportunities for entrepreneurs, and lots of excitement in an industry that's growing so fast. So without further ado, I'll go ahead and introduce my guest. So tonight we are joined. Well, I am joined by Dr. Glenda Lindsay, founder of the Inspiration Factory. Welcome, Glenda.
Thank you. Good evening.
And also Miss Diana Sugiuchi, nutritionist, owner, dietitian, and owner of the Nourish Family Nutrition. Welcome, Diana.
Hi, thank you.
Great. So let's go ahead and dive right in. Let's start with Dr. Lindsay. Can you tell us a little bit about your path and what led you into the health and nutrition field?
Okay. I've always been interested in nutrition, and so I decided years and years ago to major in nutrition at Morgan State University. I graduated in 1993, but before that, I graduated in biology, so I was a biology teacher, but I decided I want to do one-on-one counseling, and so that's when I switched to nutrition. And from that, I went to Compton to get my master's degree, and then came back to Morgan to get a doctorate in public health, because I began to want to know more about populations and communities and nutrition.
Okay. And Diana, can you tell us about your path into health and nutrition?
Yes, so I graduated from Morgan in 2006 with a degree in nutrition science, and I had as well always been interested in food and cooking and nutrition and how it affects our body. So I was very happy when I discovered the nutrition program at Morgan. So I graduated again with my degree in nutrition science. I did my internship, and then I worked in a variety of different settings. And I'm very happy with my decision.
Cool. And how long ago did you start Nourish Family?
So I started that in 2009, and it started as kind of a part-time, one-on-one nutrition counseling business while I was also working full-time at various other jobs, and then it grew from there. And now I went full time with that, I think, in about 2012.
Awesome, awesome. And Dr. Lindsay, when did you start Inspiration Factory?
Uh, it was 2 years ago, right after I've completed my doctorate in public health. And I decided that I wanted to do something independent. I had worked for agencies like the WIC program, Baltimore City Health Department, even spent some time working with students at Compton State University with nutrition as well as education, because my master's degree is in adult education. But later on in life, as I am an older, elderly person, not elderly, but I'm not a spring chicken, I would say, I decided that I would do something on my own, because I worked for institutions pretty much all my life, and I wanted to have more flexibility in what I did. And so I decided to, along with my partner, to start the Inspiration Factory.
Okay. And so why did you all both did the master's degree at Morgan, or was it bachelor's at Morgan?
Bachelor's.
Okay. And why did you all pick Morgan's nutritional science program?
Well, I
Um,
can go ahead.
Oh, I was going to say, I also have just a bachelor's in nutrition science. I picked it honestly. I live in Baltimore. I'm from Baltimore. I had small children when I did the program, and it was, very convenient to me. And they were very flexible with the classes, doing that kind of part-time. So that's why I chose Morgan.
Okay.
I think for me the same thing. I gotten a degree already from Morgan in biology, and I had such a great experience in earlier in life, because I got my biology degree in 1975, and so I knew that Morgan was a great place to go, and so that's why I decided to go back to Morgan to do my nutrition degree again. It was close to home, and I worked. At Sojourner Douglas College then, and so I was able to, because I worked there in the evening, so I was able to go to Morgan during the day, and it wasn't a long commute or anything like that. So I decided to go back to Morgan.
Okay. And Dr. Lindsay, are you also originally from Baltimore?
Yes, I am.
Okay, great, great, great. All right, so let's talk about how you all got set up in the health and nutrition field, establishing your businesses as businesses. So let's talk about what type of certifications outside of the degrees in the field. Were there additional certifications that you had to have to actually practice as a nutritionist or dietitian? I'll start with you, Diana.
Right. So in every state is different as far as having licensure for registered dietitians. So the registered dietitian credential, in order to achieve that, you do an internship for a year and then you take a national exam. But every state is different as far as whether they have licensure or not. So I am also licensed as a licensed dietitian nutritionist in the state of Maryland. So I had to apply for that after I became a registered dietitian. As far as opening Nourish, I didn't need any other certifications, but I did go back and get the American College of Sports Medicine health fitness certification, just because I wanted to have that background in exercise physiology as well. So I did that. But in order to open my business, just being licensed in the state of Maryland was really what I needed to do that.
And what entity structure did you use for Nourish?
Right. So we are an LLC, and then later on, I changed it to an S corp.
Okay, okay. So I want to ask about that. I want to go back to that in a moment. But Dr. Lindsay, can you tell us about any sort of additional certifications or registrations that you needed to begin your business, the Inspiration Factory?
Pretty much the same thing. You had to. Well, Morgan didn't have a program per se to be a dietitian. You did the coursework at Morgan, and so then I went to Howard. They had a cup program, and that way you are uh, licensed or certified to take the national exam. And so I did that at Howard, and after I finished Howard, I took the test to be a registered dietitian. And in the course of doing that, I also took the exam. Well, it was pretty much the same exam in the state of Maryland. If you passed that exam and you still had to apply for the state of Maryland to become a licensed dietitian. Again, as Diane said, for my business, I'm a LLC, and so that was the only certification I needed for that. Right now, my company and I are working on certification, so we can be certified as a business in Maryland.
Okay, okay. And Diana, you mentioned that you were an LLC and you switched to an S corp. So I know that entity selection is a really, really big topic, especially for newer entrepreneurs. So can you shed some light on what went into that decision to go to an S corp?
To be perfectly honest, so when I started as an LLC because I knew that I wanted to have my business separate from my own personal finances and liability and all of that. And then the decision to become an S corp was actually suggested by my accountant. So he thought that would be a better way to go. So that's why I made that change.
Okay, okay, awesome. That's a lesson in itself. Ask your accountant when you have
Yeah, and
these types of questions.
I would just add, I mean, I'm a registered dietitian, so the whole business entrepreneurship thing kind of came about, just on my own, just, setting all this up. So having a really good team of people to advise you is, you have to do it. So having a good accountant who you trust, when you're setting up your corporation, it's actually pretty easy to do online, but just having those resources is going to be invaluable.
Cool, cool. All right, so let's talk about how you all market your products and services. And I guess first, let's make sure the audience is clear on what exactly your products and services are. So, Dr. Lindsay, can you tell us at a high level what are your primary products and services that Inspiration Factory offers?
Okay, what we offer is I do a lot of consulting work and as well as youth development. I do nutritional counseling, and I also work, I would say my consulting deals with also the Academy of Nutrition and Dietetics, where I do some work on studies and so forth with them, writing, not writing grants, but scoring grants. Um, Programs of that where I still get paid for doing that kind of work for them as well. But mainly, I would say consulting, youth development. Right now, I'm doing youth development using nutrition at the Impact Hub in Baltimore on North Avenue. And so I would say I was selling services where I want to move into a product, but right now it's services.
Okay, and those are services primarily targeted to
To
individuals,
youth,
as individuals are your customers, or?
individuals as well as youth.
Okay, okay. And Diana, how about Nourish Family? What are your primary products and/or services?
Right, so primarily we provide services. So we do about half of our business is one-on-one nutrition counseling. So Nourish is both myself and another full-time registered dietitian, and we both do one-on-one nutrition counseling for adults, children, adolescents. And then the other half of our business is actually doing corporate wellness. So we work with companies of all different sizes. We provide seminars, cooking demonstrations, webinars, all kind of corporate nutrition programs to help employees be healthier. So we do that for clients in Maryland, Virginia, DC, all over. And we also do, we do have a product, so we do have an online meal planning boot camp that is just purely an online product, but mostly what we do is provide those services.
Nice, nice, nice. And mentioning online, I guess interesting fact that we can throw out to the audience is I actually worked at Exit 10 a few years back, which is Diana's husband's company. And while a web developer there, one of my projects was to help with Diana's website. So her online bootcamp is on that website. And what is that website?
It is nourishfamily.com, and it is a beautiful website thanks to the programmers and designers who did that. So that has been a key factor in the success of our business, is having that online presence and having a very professional website that really highlights what we do and our philosophy. So again, having that team of professionals that can really advise you and help you to put your best foot forward is just invaluable.
Absolutely, absolutely. And so let's talk about the names here, the names of businesses. So a lot goes into a name. I know a lot of there could be an interesting story behind the name. So how about Inspiration Factory? So Dr. Lindsay, can you tell us? And usually when you think of health and wellness, I guess inspiration is a higher level concept than what I would think about as traditional health and wellness. Can you tell us a little bit about what led to you choosing that name?
Okay, pretty much all my life, when I have in my career and even in my personal life, people always said that I inspired them. And so that was one of the reasons why we chose Inspiration Factory, and that's what we try to do now with young people, uh, adults. We try to inspire them to move forward if they want to lose weight, or even just because weight can be just weight, but it can also be your attitude. And
Hmm.
so that's one reason why. And the other reason why I call it Inspiration Factory, because it has IIF, Inspiration Factory. And my mother used to say a poem all the time, and she called it If. And so those two, and the poem was about inspiring people to become better than what they are. And
Oh,
so those are the two reasons why we named the company Inspiration Factory. And my mother was the main person to inspire me to go back to school and become a licensed dietitian.
okay, okay, awesome. And Diana, how about nourish? A lot of times, I think when I think about health and wellness, I think about the health and wellness of an individual, things that an individual is doing to improve their health and wellness. But you saw it as important to include family in the name of your business. Can you tell us a little bit about that?
Right. So when I was coming up with a name for my business, a lot of dietitians just kind of go by their own name, whatever that is, dietitian. But I always knew that I wanted my company to grow to, be a little bit bigger than me, and also nobody can pronounce my last name. So that was just a total non-starter as far as naming my business. So I actually turned to family as well, and my sister, who is extremely creative, very good writer, helped me actually come up with that name. And when I started, I really wanted to focus on the health of families. So my vision for my company was that I was going to be like going into people's houses and kind of turning around the nutrition of the entire family. And it went in a little bit of a different direction than that. But actually, when we were redoing the website and kind of brainstorming on that, someone mentioned, well, Nourish Family, it's kind of like a family of services that you provide. So I kind of like it in that context too. But we are very much focused on families, maybe not seeing them all at once, and having that be the focus of the business. So, a lot of times we just call it Nourish, but it is Nourish Family Nutrition. So,
Awesome, awesome.
yeah.
So let's talk a little bit about the difference between targeting a business or targeting services to consumers, individual consumers, and targeting your services to organizations. I guess how have you all? What are the pros and cons on each side? The working, targeting towards the organizations or selling your services to individual consumers. And I guess I'll start with Dr. Lindsay.
Uh, Let me see. I think it's difficult in both cases. Let's start with the individuals. Sometimes when you, as a dietitian, especially with the minority communities, sometimes they don't see the necessity of going to a nutritionist, and they think, well, I can do it myself. And when they do, and it's hard when you for them to pay out of pocket. Sometimes they may have the money, but it's hard for them to say, well, I'm going to use that to pay a dietitian. And that's why a lot of dietitians do use insurance companies, but that can get kind of it's not that easy as well. But and then you have the problems with a lot of people who may come for the first visit but may not come back for the second visit. And so nutrition is all about follow up. But you do have people who, and I have found in my career that people who are older are more compliant, as well as they will do return visits and so forth. But I'm still working on that. Now with organizations, it's not as difficult, but you have to find organizations that will need your services. Right now, I do consulting work with Head Start, and that is not too difficult because I just go in, I do nutritional assessments with the little kids. I also talk with the employees, the teachers, as well as the food service workers. And that is not as difficult because long as you do your work, you do the invoice and you get your money back. Now with Impact Hub this summer, we're doing a service for them, and that's pretty much helping the youth in that North Avenue corridor. And so pretty much we're on our own, and we have them there for doing administrative work and being a part of their organization. So that is not too difficult at this point right now.
Okay, and Diana, you do you have a corporate wellness is a big part of your business, as you mentioned, and then you also do some consulting for individuals. Is it easier to land the corporate clients than the individuals, or easier to land the individuals than the corporate clients? Can you tell us a little bit about that?
Yeah, so it really depends. I mean, in our practice, we do accept insurance, which I didn't when I first started out. That was a very good business decision, as well as just a professional decision, because what I find is that a lot of the people that I prefer working with, as far as one-on-one nutrition counseling, are generally the people who can't afford to pay out of pocket for it, who are, very sick, who really need a lot of help. So that's been great as far as growing the business. We have never paid for advertising, with the exception of a few, boosted Facebook posts here and there. But we receive a lot of referrals from physicians. So physicians know us, they trust us, so they refer their patients to us. So in that sense, we really don't do a lot of marketing to individuals. They just sort of find us. And as far as the corporate, it is more bang for your buck. It's corporate wellness, so you can bill a lot more per hour than you bill an individual client. You also reach a lot more people that way. I find that actually it is more difficult to land those clients because it involves a lot of, conference calls and back and forth about the programs, and getting the corporate clients to trust you, as well, since it is a larger amount of money. So, yeah, they both are very separate and unique situations. So, certainly different approaches for marketing to each of those populations.
Okay. And you also have the Vertical Drop Nutrition brand. Can you tell us a little bit about how that's different from Nourish, or what your target is there?
Yeah, so that's actually, Vertical Drop Nutrition is a blog that I started because I love to ski, and I was really surprised that there's not a lot out there for nutrition that is specific for skiers. Every other sport, there's like all that kind of sites about nutrition for like marathon runners and bicyclists, but for skiing there really wasn't a lot out there, and it does have a lot of really unique nutrition needs. So I started that blog just kind of as something fun for me to do, to reach out to other skiers, and I've give talks to different ski clubs, resort groups about good nutrition for skiing. So that's that's more something I do just kind of for fun and to support my ski habit. So
Okay.
yeah.
Cool. So one of the things you mentioned that I want to go back to is how it was a great business decision to begin accepting insurance. So if someone is in the industry right now and they're thinking about this, and what's the process to be able to accept insurance as a nutritionist or dietitian?
Right. So the process for accepting insurance, you need to be credentialed with every insurance company individually. So if you're, want to become a provider for Medicare, you have to apply with them and go through their process. If you want to apply for Blue Cross Blue Shield, you have to go through their process. So I mean, it is a learning curve. It's a lot of work up front for that, but there's a couple of reasons why I firmly believe that all dietitians should do that. Number one, because we are medical professionals, and it's what separates registered dietitians from people who have like an online certificate in some kind of nutrition training who are health coaches, is that we are medical professionals. We can accept insurance, and especially with Medicare, that's very important that we keep our names out there, that we are the professionals for helping people, with their, counseling them for nutrition, because you hear a lot about doctors not doing enough, but it's actually, registered dietitians who have that training in order to help people make those changes. So I think, from a business decision, if people know that they can use their insurance to have nutrition counseling, of course they're going to do that rather than paying out of pocket. Although we do have a number of patients who do pay out of pocket, whose insurance, we don't accept their plan or whatever. But I just think that it's important from a professional standpoint also to be credentialed in order to do that.
Awesome. Okay. So let's talk about major successes, developments. Anything new in the past year or so that you guys are, or you ladies are really excited about in your businesses?
I think for me, the relationship that my company have established with the Impact Hub, where we're able to reach a lot of young people, and we can see that we have them interested in what we're doing. And the Impact Hub is composed of quite a few public health practitioners from Johns Hopkins University, and they reach out to the community, but they did not have a youth development component. And then my company came in to fill that need for them. So I'm
Okay.
pretty much excited about that, as well as my continued relationship with the Head Start program, because I see that as being the Head Start program, which is a federally funded program. I see the impact that it has on the children, because I even have 3- and 4-year-olds telling me, I don't eat candy, I eat fruits and vegetables. So if they don't do it exactly at home, at least they know. And I think that you need to start with children at that age. And if they go stray from it, eventually they will come back to what is the right food to eat. So I'm pretty much excited about that. Looking for some other things to do this year, but those 2 things I'm very excited about.
Okay, awesome. Diane, any recent developments in your business?
Yeah, actually this past year has been a time of huge growth for our company. So I had a dietitian working for me part-time, and she came aboard about a year ago full-time. We opened up another office. We actually opened up 2 different locations, so we now have 3 locations in Baltimore, and we're actually looking to hire another registered dietitian or 2, so we're hiring, so that's super exciting. So there's been a lot of growth. So yeah, we're looking forward to more of the same in the future.
That's great. Maybe there's someone watching who wants to get into this field. There's a perfect opportunity.
Yep.
If they're registered, of course. All
Mhm.
right. So let's talk about the challenges. So we talk about the successes, and what are some of the challenges that you all are working on overcoming now, or maybe challenges that are coming down the pipe that are just kind of racking your brains right now as relates to this industry and new things that are coming up?
Well, I think one of the challenges for me, because before I started my doctoral degree, I saw more patients through insurance, and so I have to build that back up. But I couldn't do both. I couldn't because getting a doctorate means you have to spend all your time on that, and so that is a challenge. But I'm working on that this summer. I have a person who's helping me with that. I think that was one of my major challenges this year, and to try to be able to go into other organizations um, to establish more youth programs in nutrition as well as public health. And so that is one of my, our biggest challenges facing us this year.
Okay. Any challenges on your side, Diana?
Yeah, there's always the challenge of balancing, doing the work that needs to be done while also getting out there and, having those visits with the doctor's office, marketing services, carving out the time to do that, to, update social media, to write blog posts, all that stuff that kind of keeps you out there and fresh and, kind of in the public eye. So that's always a challenge. I wish, that I frequently wish that we had, like a someone could do all that for us would be great, but right now it's just doing that ourselves. So I would say managing time is always a challenge, and just keeping the name out there, making those contacts, doing that networking is always a challenge.
Okay. And so I guess as professionals in the health field, you probably get this question a lot, but how has, if at all, has the Affordable Care Act affected your business?
It's been fantastic for me because it's increased insurance payments for nutrition counseling. So from my perspective, it's been absolutely wonderful.
So does that mean that
Same.
Okay. So does that mean when you say it has increased insurance payments, does that mean that there are more people paying for, or more people whose insurance plans are paying for diet and nutrition services? Is that what you mean?
Right. So when I first started accepting insurance, goodness, when did I do that? Maybe 2012, 2011. A lot of plans would only pay for diabetes or heart disease, but with the Affordable Care Act, because they pay for preventive services, nutrition is considered to be a preventive service. So that kind of opened it up to basically anyone that wants to eat a healthy diet, which is great, because then instead of seeing people once they're already sick and they have all of these issues, you're seeing them before they get sick, which is the way that nutrition works. You eat a healthy diet, you exercise, and then you don't develop diabetes, high blood pressure, heart disease, all of that. So that's been fantastic, not only from a business perspective, but also for everyone, because these services are now available to you. Medicare has not caught up with that, unfortunately, but the private insurers have.
Right.
Interesting.
And I'm also an advocate for the Maryland Academy of Nutrition and Dietetics. I'm on the board. And this recently, as of last week, we went to Capitol Hill to try to advocate that Medicare pay for preventive insurance. Now, it's a difficult task, but what I do like about dietetics is that we have a lot of dietitians who are advocates who know that their policy is so important to improve our the work that we do, and so we always have we do one for the state of Maryland in February. The main we call the Maryland Academy of Nutrition and Dietetics, and the one for national was last week. And so we're always trying to push for more policies, more bills that will help dietitians be able to bill, especially for Medicaid, for obesity, um, diabetes, as well as child nutrition. So that's one thing that makes me excited about our field, that we just don't stand back, that we try to advocate for our needs, because years and years ago, dietitians didn't get anything. You had to kind of bill through the physician, and if they wanted to pay you, they paid you. If they didn't, they didn't. So we have improved a whole lot in our field of dietetics and nutrition.
Interesting, very interesting. I think a lot of people don't realize how important the political or the policy aspect plays in people's
Hmm.
everyday nutrition and health. I think that's really interesting perspective there.
And we do have some. I know my representative is John Sarbanes, and he's advocate for this for nutrition. And then the state representative is Dan Monahan, and both he is a physician. And so we do have some politicians that are very much interested in health and nutrition of the nation. So you have to support them, and they will support you.
Okay. All right. So here's a fun question. So being that you all are health and nutrition professionals, I thought we should take the time to get some free health tips. So, so all right. So here we are in the middle of summer. You know, it's cookout season. You know, people are eating burgers and hot dogs and steaks, soda, out in the hot sun. So, and we got July 4th coming up, so there's going to be a lot more of that, you know, this coming weekend. So, what simple things would you advise, you know, listeners or watchers, viewers to do to make their cookouts healthier?
Yeah, so I would say for a cookout, if it's a party, like you shouldn't deprive yourself all the time. So I would say like pick, something that's really important to you. So if you don't love the chips, like don't have the chips, have the hot dog. If you don't love the hot dog, then, maybe have some chips. So kind of prioritize. Just because it's there doesn't mean that you need to eat everything there. But if there is something that you really love and you're like, oh, it's 4th of July, have one thing that you really enjoy. Watch the alcohol. It has a lot of calories, and also, when you drink more, you're likely to say, "Hey, I'll just have, some more chips or cake or whatever it is." And stay hydrated, especially in the hot sun.
Mhm.
Getting dehydrated is really easy to do. When you're outside a lot.
Cool. Dr. Lindsay, any
And I
tips?
would, with that, that was one of my things. Yeah, that was one of the things I would say. Stay hydrated, drinks plenty of water, emphasize fruits and vegetables. Even at cookouts, if you have like take a watermelon for example, make a fruit salad out of that, with adding fruit and make the fruit salad inside the watermelon. It looks pretty, and then a lot of people will or just gravitate to it because it looks pretty. Also, and that's what another thing I like about being a dietitian. Most of us are realistic. We know that people have parties, and it's the 4th of July and so forth, and so you eat in moderation. You try to eat. Make sure you have salads as well as your hot dog or your hamburger, but have a salad with that. Um, Eat, like I said, have one hot dog instead of two or three, things like that. Enjoy yourself. Uh, Also, you can what we do say sometimes if you know the 4th is coming up. Well, during the course of the week, cut back on some bread or some sweets and so forth. And I always tell my patients that you can have things in moderation. Some of them laugh at me when I say the slice of cake they can have, or cookies once a week and so forth. But at least they're listening. At least you're telling that we don't try to tell people don't eat. You just have to be perfect, but you can eat in moderation. Eat more fruits and vegetables. Drink water. And I thought I was the only dietitian that did this until Friday, I heard a dietitian say that she tell her patient that well, if you like lemonade, have half lemonade and half water. You just want the flavor, and that's what I do pretty much all the time, and teach other people to do that. And so, because we know people are people, and they really like that. People like to enjoy their food because sometimes people who are not dietitians or people in general. Uh, Kind of make especially women have a love-hate relationship with food, and you need food for nourishment, and so enjoy it but eat in moderation.
Okay, all right. Wise words for your your cookouts and your 4th of July celebrations this weekend and other events this summer. So thank you all for that. All right, so let's talk about you all's inspiration. So Diana, do you have any mentors or folks that you look up to in this industry or in business in general that have kind of helped you along?
Yeah, so I am a member of a couple of different dietetic practice groups through the Academy of Nutrition and Dietetics. One of them is the Nutrition Entrepreneurs practice group, and they have a very active listserv. So when I was getting my practice off the ground, I just read through those questions that people would ask. I asked questions of other dietitians who are very generous with their expertise and their time. To kind of help me out. Rebecca Bitzer in Columbia was also very nice to kind of help me, work through some different things about starting a private practice. So yes, I've been very fortunate to have other dietitians who inspire me. I'm currently part of a mastermind group with about 4 or 5 other dietitians. We have a monthly call. So that's been very, very inspiring to me with getting new programs and services off the ground.
Awesome. So I guess that's more along the lines of putting together that great team. Mentors fall right into that team. So
Right.
that's awesome. So Dr. Lindsay, who inspired? Well, you talked about your mother inspiring, the name behind Inspiration Factory. Who
Right.
inspires you when it comes to your business and you being?
Okay, when I did my community nutrition rotation at Howard, it was a lady that I did my rotation with, and that was Steva Comey, and she had her own business then back in the 90s. She's also a Morgan graduate, and so she kind of inspired me to go into private practice. She still is, and we still see each other from time to time. So she put the light bulb in my head to do that. Also, another Morgan graduate, Lamilla Scott, when I got out of finished my doctorate, she had a doctorate in public health as well. She and I worked together for a while, but she moved to uh, out of the country now. She may be back, I don't know. But so she inspired me. I saw how she did business, how she networked and so forth. And so that inspired me. And my dissertation chair, Dr. Yvonne Bronner, she too was a dietitian. And the way she conducted herself, she's not in private practice, but she had a wealth of knowledge in nutrition. She's very active in the nutrition field. So all 3 of those ladies inspired me to what I'm doing right now.
Okay, awesome. So I've got some fun questions here. Let's start with Diana. What is your favorite business book?
Favorite business book. Okay, so I don't actually, goodness, I don't know what that would be. I get a lot of my business, advice and knowledge online. I'll just look stuff up. I don't know. I actually bought a book about marketing, and I haven't gotten through it yet because there's just not enough time. So I'm not really great with reading business books. I kind of do it on the fly. So I don't know. I'm open for recommendations.
Okay. So Dr. Lindsay, your favorite business book or online resource, industry
Well,
resource?
I guess I I have I don't think I have a favorite business book as well. I read other type of novels, but I do look at online because I also belong to the nutrition entrepreneur practice group for the academy. So I do look at that. And also I'm also a member of the American Public Health Association, and when they do business webinars and small business webinars and so forth, I take part in that. Maybe you could recommend something that's good, I would be glad to read it, especially this summer. I have a little bit of time to do that.
Okay. All right. How about your favorite Morgan professor? I think you, Dr. Lindsay, I think you mentioned a professor at Howard that was one of your favorites. How about favorite at Morgan?
Okay. Now, Dr. Brown is more at Morgan, and
Oh,
so
she
she
was
was
in
one
Morgan.
of my
Oh, okay,
favorite.
okay.
And then it was and right, and then Dr. Whitaker, she used to be in nutrition. Now I think she's in consumer science. So when I went to Morgan in '93, and she's the one that inspired me to go on to Howard, to the CUP program. Then after I finished that, she inspired me to go on and get my doctorate. So I would say her, as well as Dr. Bronner. Um, and I can't think of his name right now, but I had an anatomy teacher at Morgan who told me to be the best that I can be and be the expert in my and what I can do. And I cannot think of his name right now, but he also inspired me, along with, he's deceased now, Dr. Roy Hunter, when I was a biology major. And he always encouraged, he told me one day to go get my doctorate, and I did. And so had always encouraged me at Morgan. It was and still is some great instructors at Morgan.
Awesome, awesome. Diana, any favorites, favorite professors at Morgan?
Yeah, so I would echo Dr. Whitaker when I first came in as a transfer student. You know, she's going through my transcripts and looking at everything, and she goes, "You need to get a job." And I was like, "I need to do what?" And she goes, "You need to get experience in the nutrition field." She goes, "If you want to get an internship, you need to go out and get." And this was like my first day that I was, even at Morgan. Um, and I was like, oh, that must be pretty important. So I took her advice to heart, and I went out and I worked every other weekend as a diet tech at Maryland General Hospital, and I volunteered for Meals on Wheels. And that was such good advice because getting that internship after I graduated was such a competitive process. And if I hadn't had that work experience, I've probably gotten it. So I was kind of overwhelmed by everything when she told me that, but it was really, really good advice. Also, another favorite professor, Dr. Ivis Forrester Anderson, was just phenomenal, especially in the food science classes. We did a food science lab with her, and I just, really enjoyed that. She does a lot. She does a lot of research as far as that goes, and was just very helpful and opened up my eyes to a lot of the kind of food science and sensory aspects of that.
Awesome. Okay. All right. So this question is for either of you, but okay, let's say that, we never know who's going to be watching this today live, or, once it goes on YouTube, it'll be there for, you know, it'll just be there for anyone to pick up. And if there's someone watching who is already in the health and nutrition field, or maybe they're maybe a student at Morgan right now who's in that nutritional science program, and they'd like to be where you all are after they graduate. They like to, go into their own practice. What advice would you have for a student watching this now? And I guess one of those good tips was, that internship experience. So, any other types of final advice for viewers that are interested in pursuing businesses in the health and nutrition industry?
Well, I
I would
think that, I think that you just have to let young people know they have to stay the course. You have to work hard, as well as you have ups and downs. You maybe think you're getting the contract, and it's almost up to you getting it, you don't. And so I have written some grants as well. Some I got, some I didn't. And but still, you look at the side of it. You have it's flexible. You own your own business, and what you create, you create it for yourself. You're the person that created. And I have worked and done some great work for some institutions, but it was still theirs. And so when you own your own business, what the product or the services you create, you pretty much have your hand on that. um, Again, you have to be licensed, and you have to study hard for that license exam. um, and so it's not easy, but it's very rewarding in the end.
Okay.
I would echo that. I would say, you need to be persistent. It's not going to happen overnight, so you need to really, have that vision, and you need to work literally all the time. I mean, I feel like in some capacity, I'm on vacation right now, and I've been, answering calls and doing things all day, and that's kind of how it goes when you own a business. Is you're never fully off, but at the same time, you're never, you can take that time for yourself, because you own your business. And the other thing I would say, in addition to being persistent and having that vision, is you have to be flexible. That flexibility is so important, because the direction that my business is going now is not how I envisioned it when I first started out. And if I had stuck to that initial vision and said, no, this is how it's going to be, this is how it's going to go down, my business wouldn't have grown. So being able to roll with those punches, when you don't get that contract, what's your next step? What are you going to do? And just saying, all right, so this idea didn't work out, so let's try this other thing, is going to be of the utmost importance.
Awesome. All right. So can you tell our viewers how they can contact you if they'd like to learn more about Nourish or Inspiration Factory? Diana, can you start? Can you tell us how can we find you? Your website, social media, any other details you want to give us?
Yeah, so our website is Nourish Family, Nourish family.com. We're also on social media. We're on Facebook. We have a Pinterest board. We're on Twitter, but not awesome about Twitter. And Vertical Drop Nutrition is verticaldropnutrition.com. We are on Twitter and Facebook as well.
Okay, Dr. Lindsay, how can we find Inspiration Factory?
Well, Inspiration Factory has a website, inspirationfactory.me. We also have a Facebook page. The camp that we have, Camp Community, has a Facebook page. And I have my own Facebook page, just Dr. Glenda Lindsay, and what I post, what I'm doing and so forth. And Instagram as well, and as well as Twitter.
All right, awesome. We'll make sure that we include those links in the show notes so folks can find that on our website as well. And our website, of course, is the Morgan Entrepreneurship Alumni Chapter is morganeac.org. So I want to thank you, Diana, thank you, Dr. Lindsay, for spending your time with us this evening, even on vacation. Diana, thanks for giving us some time to share these insights. Thanks a lot.
You're welcome. It's been fun.
You're welcome. It was a pleasure.
All right, and just before we close, I want to make sure I throw out a few announcements. So this event is monthly, as I mentioned as we started. So every month we pick a new industry. Don't have the industry for next month set yet, but we do have the date, and the date will be Thursday, July 28th. That will be our next Alumni Speak. So stay tuned and come back to us. We'll be live again. We also, another production of our alumni chapter is The Bridge. The Bridge is a podcast, so you can find that on our website as well. Every Monday, we release new episodes of our podcast, and that podcast is where we do similar interviews with entrepreneurs, Morgan alum entrepreneurs, but those are quicker, higher level interviews where you get an overview of what different entrepreneurs are doing. So be sure to check out that as well. And of course, we're always welcoming new alumni, Morgan alum who are out there who own businesses to join our chapter, the Morgan Entrepreneurship Alumni Chapter. We meet monthly, the first Tuesday of every month. So our next meeting, general meeting, will be just after the holiday, so July 5th, 6 p.m. We do meet in person, so you can come if you're in town. If you're in Baltimore, you can come to the Morgan's new business building, and we're meeting on the 3rd floor there. And if you are anywhere else in the country or in the world, but you're a Morgan alum and you want to participate in our chapter, you can as well. You can call in. We have a dial-in number where you can dial into our conference call and hear everything that's going on and be a member that way as well. So that's all for tonight. I definitely want to thank our guest again, and I want to thank you for watching. Have a good night.
Good night.
Good night.